Good day, viewers, and welcome to the first edition of the Healthy Living series with me, Bintu Bangura. This is a program that keeps you up to date with everything that has to do with living a healthy lifestyle. The entire Healthy Living series program has 3 sections: the Healthy Living Expert series, the Healthy Living Diet Tips, and easy and effective exercise routines we can use even when we are at homes. In today's edition, we would be looking at the Healthy Living Expert series. In this expert series, we will have series of discussions and interviews about ailments that are affecting the general human population. But as you all know, we are not doctors or healthcare workers. So we have thought it fit to be bringing in doctors and healthcare workers to enable us understand what these ailments are, how they affect us, how to manage them when we have them, and how to access cure if they are curable. Today we're going to be talking about diabetes. Most of us would have heard about diabetes. We might have family members suffering from diabetes. Or worse still, we might even be living with the condition called diabetes. But are we well informed about the ailment? Do we know how to manage it well? Do we know how it affects us, what signs to look for? And do we know how to access cure? All of these questions would be answered here today. And to help us answer these questions, we have brought in a very special guest who has been active in the diabetic community, especially in Sierra Leone, in raising awareness and campaigns about the disease. This person is also a doctor of pharmacist, and she is the owner of the City Globe Pharmacy. Let me introduce you to Dr. Manal Ghazzawi.
Thank you. Thanks for having me.
Thank you very much for coming, and welcome to the program.
Thank you.
We are especially happy to have you here today because, taking into consideration the drastic change in your work environment, and still you can make time for us to do this interview, it means a lot to us. So that begs the question, how drastic has your job changed during this process? And even though I have introduced you, they say a man's best servant is himself. So I would like you to tell viewers a little bit about yourself and the work you do, just a little bit.
Yeah, well, hello everybody. My name is Manal Ghazzawi. I'm a clinical pharmacist and I own 2 community pharmacies called City Globe Pharmacies, which essentially operates as a diabetes clinic and catering for the community around those pharmacies in the supply of all necessary drugs, and of course also making sure that the right services of pharmaceutical care is being rendered. So City Globe has been known mostly as a diabetes clinic, taking care of diabetic patients that have already been diagnosed with diabetes, and even in the prevention of diabetes or any cardiovascular disease. We were also highly involved in screening of people or the general public for those wanting to know their status on hepatitis B, and we've been highly involved in vaccinating thousands of Sierra Leoneans so far against hepatitis.
Oh, what a marvelous job you've been doing. And so you are responsible for people with diabetic conditions, and you have been doing work with them. So what has changed in this era of COVID? Has anything changed within your job?
Yes, the main challenge we're facing right now is adequate supply of drugs, not only to individuals but even to governments, to treatment centers. That is one of the biggest challenges. The other challenge is most people are shying away from the hospital, so we at the pharmacy or community pharmacies are at risk of contracting the disease right now, because you have many diseases that have overlapping signs and symptoms to that of COVID-19.
Yeah.
And the other challenge which I feel guilty about is the fact that we cannot check or monitor blood glucose levels of diabetic patients because we cannot come in direct contact with them because of all what's going on. So the best they could do is to buy their own glucometers,
Which is quite expensive for most people.
yes.
Oh my goodness. Well, enough of that for now. Let's come to the matter at hand. Diabetes, doctor. What is diabetes?
So now we're here to talk about diabetes mellitus. So diabetes mellitus is a chronic condition, that is a condition that you live with for your whole life, in which there is abnormal blood sugar level. So that could result either as a result of lack of insulin in the body, that is the hormone responsible for regulating the sugar level, or as a result of your body not responding to the action of insulin. So it all depends to the type of the type of diabetes that is happening in the patient.
Wow. Okay. So when you say insulin, so does everybody have the same level of insulin production?
No. First of all, the insulin is a hormone produced by the pancreas, which is an organ found in us.
Okay.
So usually if you have a hereditary condition or you have family history of diabetes, your body will start to not respond to the action of insulin. That is if you are overweight. That's mostly what happens in type 2 diabetes. While as in type 1 diabetes, suddenly it can be caused by hereditary conditions, or it can also be that the body acts against itself, where the cells producing insulin are being destroyed, or even viruses can even destroy those cells producing the hormone insulin. So that's
type
why
1 diabetes.
Yes, so that's why type 1 diabetics highly are dependent on taking in insulin, while as type 2 you can go on with your life without insulin.
So type 2 is the one that is hereditary.
Both of them are
Both of them
hereditary, but also type 2 can be as a result of lifestyle.
Okay.
Yes.
When you say lifestyle,
Unhealthy lifestyle.
when you say unhealthy lifestyle, what does that mean?
So it means someone does not know exactly or is not adopting healthy eating, eating the right foods, eating vegetables and fruits every day, having the right supplements in their body, or exercising also is very key. Exercising does not only help you to lose weight, but it also helps to regulate your lipid level. It also makes the insulin work better in the body.
Okay. Good. So, while you were answering the first question, you spoke about overweight in relation to a higher risk of getting diabetic condition. So, for me, I'm slim. Am I also at risk? Is it possible for slim people?
Yes, it's also possible for slim people to have diabetes, especially if you're not exercising and you're not eating the right food. But again, obesity is a major cause of type 2 diabetes currently because of the adoption of the westernized culture, or the adoption of westernized foods, or because of the proliferation of fast food restaurants in the country. We are prone to having more obesity, which increases your likelihood of having type 2 diabetes. But for as long as you're slim and you're young, your risk will not be as high as when you grow older.
Okay.
If you grow older, above 40 years or 45 years, then you still do not eat healthy, you're not physically active, you're drinking lots of alcohol and smoking. So all those predisposing factors will lead you to having diabetes, even if you do not have a family history of
diabetes.
Yes.
Okay, because I had a friend who once told me, oh, your mom is diabetic, so you have to be careful not to catch it. Then another one told me, no, diabetes is paternal heredity, not maternal. So can you throw light on that for me?
No, diabetes is you are prone to having diabetes, whether it's your mom or your dad. There's what we call first degree family history.
Okay.
First degree, that is your mom, your dad, or your brother, your sister. These are first degree. So as long as you have within the first degree of your family having diabetes, then you are prone to having it. But the risk will only increase with age, especially with type 2 diabetes.
Okay.
But with type 1, if for example a twin has type 1 diabetes, there's a high likelihood of the other twin partner to also have type 1 diabetes.
Okay, tell us about the diabetic condition that usually occur on pregnant women.
Yeah.
Is it possible for somebody that has not shown any sign of diabetic condition previously to develop
yes, that's what we call the gestational diabetes, which is the third type of diabetes. So mostly women around 20 weeks of pregnancy are prone to having type 2 diabetes, but that is just temporary.
Okay.
So after delivery, she goes back to having no diabetes, but she has a likelihood risk of having diabetes in the next 5 to 10 years, provided she does not control her lifestyle in terms of the food that she's eating and exercising.
Wow, so we'll say that is an alert in itself, that you have to take care of your lifestyle so you can maintain a healthy life in the future, otherwise you...
So most obese women, for example, that become pregnant have high risk of developing type 2 diabetes. And the risk will increase if they already have family history of diabetes or previous gestational diabetes. So all that will increase their risk.
Okay, I think we've dealt with the types of diabetes and we now know what causes diabetes. And we know that both slim and obese people are at risk of getting diabetes depending on the lifestyle you choose. And we also know that eating healthy and frequent exercise or regular exercises can help you mitigate that risk. Now, doctor, diabetes, you know, with all the improvement in medicine and everything, is it curable?
No, diabetes is not curable. It's only managed all throughout your life. But there are ongoing studies or research to actually see whether it's curable or not. For now, the research that is going on is mostly has to do with remission. Okay. That is, people go on a strict diet and be physically active and lose lots of weights, especially at the beginning of diabetes. For example, if someone has been newly diagnosed with diabetes, it is possible that you can reverse the diabetes or you reverse your high blood sugar level in your blood, and by losing lots of weight and maintaining a normal sugar level for a certain period of time. But for how long someone can actually do that perfectly? So eventually, during that period where you can lose enough weight, control your food and all of that, that's what you call the remission period. So you can maintain that period for a 6 month to 1 year, or some people can do it for years. But it takes lots of work and dedication to do that.
To be committed to your healthy eating and regular exercising.
Yes, and of course, even if you're doing that, if you are prone to lots of stress also, it will increase the blood sugar
So
level.
stress is also a risk factor?
Yes.
Wow.
And even a cause of diabetes.
Wow.
Yeah, depression also is a risk factor.
Wow, I never knew. Okay, so the remission for diabetes, to go into remission for new people who have just found out that they are diabetic, is it for every type of diabetes?
Yes.
Both type 1 and type 2?
No, I'll say for type 2 specifically, because with type 1, the moment you are diagnosed with type 1 diabetes, it means your insulin production is banned. There's no insulin being produced because the cells responsible for production of the insulin has been totally destroyed. So that's why we call type 1 diabetes as the insulin dependent diabetes.
Okay. So we have a way of managing this since it's not curable, because my mom has been living with it for the past 15 years.
Mm-hmm.
So can you help us with some of these ways, because we need experts on it?
Yeah. The key management, first of all, we can talk about the pharmacologic and non-pharmacologic management. When we say the non-pharmacologic management, means management that does not include any drug. Yes, so diet and exercise play a very big role. And when we talk about diet, it means you can eat the vegetable carbohydrate, that is, for example, a sweet potato, cauliflower, cabbage, or making sure that you eat fruits and vegetables every day. But diabetics have to be careful about their fruit intake.
Okay.
They should only eat the citrus fruits. But most doctors recommend that they should not eat fruit, but I don't believe in that. I believe that diabetics should also have the micronutrients for their body to be able to sustain the disease. So apart from fruits and vegetables that should be consumed every day, they have to eat grainy products like beans, the funde, the bulgur. All these high fiber foods need to be eaten. Avoiding fried foods is very important. Incorporating nuts into their diet is also good. Eating, if they feel like eating carbs, then it has to be the healthy carbs. Yeah, not the refined carbohydrate. And also the fat intake. It has to be the unsaturated fat. That is the fat that is included in olive oil, canola oil.
So if they want to eat any food that needs to be fried, they should use those oils instead.
Exactly. Although that is expensive, but instead of using those oils or having to use those oils to fry foods, then you can roast your food and you steam it instead of actually frying them.
Okay.
Yeah.
So that's the non-pharmacological.
Yeah, then about exercise.
Okay.
It's before a diabetic goes into an exercise program, the health status of the patient is very important. If the patient does not have any heart disease, then they can do high intensity exercises or cardio exercises. Okay. If the patient has diabetes and a heart condition, then walking or swimming can be good. So exercise is very important, as I mentioned. It also makes the insulin work properly in your body. So it reduces insulin resistance. That means the ability for the glucose to enter the cells become much more easier with exercise. Yeah. And it also prevents complications of diabetes that might arise.
Okay, so we're still not touched the pharmacological side of it.
Yeah. So then still on the non-pharmacologic side, you have to also prevent stress, avoiding alcohol, tobacco smoking.
So you should avoid them, not even taking minimum.
No, in moderate quantity, it's fine. Yeah. Okay. So now for the non-pharmacologic management, there are certain drugs that are used. You have drugs that actually work, for example, in the intestine that prevents the absorption of sugar. You have some drugs that will act actually in the pancreas, letting the insulin being released in the body. Okay. So the most common ones in the country are metformin and glibenclamide, which is commonly known as Dionyl. Then you also have other categories belonging to the same Dionyl group, which is used. But there are many other drugs that have been manufactured in other countries, which is also being used, but it's not yet in Sierra Leone because it's expensive.
Some people take insulin injection.
Yeah.
What is that?
So the insulin is the hormone responsible for the normalization of the glucose in the body. So
Okay.
as I mentioned, type 1 diabetics can't live without insulin, while as type 2 diabetics, they can live without insulin for a certain period of time, but there comes a time when the body does not respond much to the drugs that they're taking, or the person's diet and exercising is not being controlled. Then if they have resistant diabetes or uncontrolled diabetes,
Okay.
then they go to start taking insulin for type 2 diabetics. Then the
Wow.
management of type 3 diabetes or the
Gestational.
gestational diabetes is just insulin. Insulin is the safest drug in gestational diabetes.
So they'll just inject you with the insulin and then
Yes.
you'll be normal.
Yeah. To prevent complications in the baby,
Childbirth.
because most women that have gestational diabetes giving birth, they end up giving birth to a very big baby, which also increase their risk of having type 2 diabetes later in life.
Wow. So tell me, what are the signs if I have never been diagnosed of diabetes and I do not go to the hospital that often? I'm at home, but what should I look for? What are the red alerts that I should look for me to even think that this might be diabetes? before
There are
going to
three
the hospital?
cardinal signs and symptoms. There's frequent urination, excessive urination, and or frequency in going to pass out urine. There's increased thirst more than normal, then excessive hunger. These are the three cardinal signs and symptoms. Then you also have blurry vision. Sometimes you have blurry visions. Or sometimes you can also have diabetes, but yet you don't realize it.
You do not show any signs
Yes,
as well.
somehow, yeah. Or you overlook those signs and symptoms until it develops, because it is known that, for example, 60% of the African population have diabetes without them knowing.
I want to believe that because sometimes you meet some people, they just started losing weight. They'll just start losing weight just like that. And you don't know what the cause. Then when they finally go to the hospital, then they will find out that they're diabetic. That brings me to the question, who gets diabetes? Is it only grown-ups, adults, or kids also?
Yeah. Before we used to have, for example, type 2 diabetes more common in the elderly or adults. But now we're seeing children having type 2 diabetes. Usually type 2 diabetes only occur in adults above the age of 45. But now because of obesity, which is on the increase among children, they are having now type 2 diabetes. But type 1 diabetes mostly affects the younger population from birth up to 30 years old.
Wow. So in Sierra Leone, taking into consideration that diabetes is really, really prevalent now among most communities, in Sierra Leone, what's the statistics of people with diabetes?
I don't know if you're already aware, but we are very poor when it comes to research.
Okay.
But those few studies or small studies that have been done can say it's up to 2 to 3%. The prevalence
of the total population.
Yes, that's a prevalence. So I don't know how much will that account for in the whole of the population. But again, that prevalence, that result I gave you is not representative of the whole population.
Of the actual thing that is happening in the ground.
Yes.
Okay, that's understandable, given into consideration the lack of well-structured research and database to keep track of people with diabetes.
Yeah.
And also the fact that most people will be living with the disease without even knowing.
Yeah.
Anyway, so
I recently conducted a research last year in which in 1,013 people, in which 17% have high risk of having diabetes.
Okay.
So when I say high risk, it means they're either obese, that is having big belly or high waist circumference, or they have high BMI, or they have hypertension.
What's the BMI?
It's the body mass index.
Okay.
Yeah.
Okay, so tell me about the greatest complications when you have diabetes. Are there complications?
Yeah, we have what we call microvascular complications, that is complications affecting the smaller blood vessels. Then you have the macrovascular complications affecting the larger blood vessels.
Okay.
So when we talk about the microvascular, we're talking about the, diabetes affecting the eye, diabetes affecting the kidney, also diabetes affecting the nerves.
Okay.
So that is what, and that's the most common complication of diabetes, which is diabetic neuropathy. And it's the first one you start seeing as a diabetic after a few years of having uncontrolled diabetes, where you start having tingling sensation on the extremity in your feet.
Toes.
Yes, or even at the
sole
of the feet. Yeah,
Okay.
you start having cramping and all of that, and that is
numbness.
yes, and that is a big predisposing factor to forming diabetic ulcers, which can lead to amputation in the future. Then we have the macrovascular complications, which affect the large blood vessels, which causes heart diseases and stroke.
That's what I wanted to ask, if it also causes stroke. What about blindness? Does it?
Yes.
Does it affect the vision
Yes.
as well?
Yeah.
So it degenerates with time,
Yes.
right?
The high sugar actually goes to destroy the nerves responsible for high visual acuity.
So viewers, I hope you are learning a lot from this program, and we keep pushing. So now we're going to be looking at diabetes and the $1 million pandemic questions. Dr. Manal, diabetes and coronavirus.
Yeah.
What's the relationship? What are the risks? What are the threats?
Diabetes is the biggest challenge globally right now for people affected with COVID. The problem is people that are diabetic having COVID will lead to more complications that will even lead to death. Because right now, according to just a brief death analysis that has been done by EOC, the Emergency Operating Response, they realized that up to 35% of the mortality rate is attributed to that of diabetes, second to that of hypertension, then HIV.
Wow.
Yeah.
So for a country like Sierra Leone, for instance, that most people do not know that they are diabetic status, then they become prone to COVID-19 without even knowing it. So is it advisable to be also doing campaigns that people should also check their blood sugar and also check if they are diabetic or not? Is that advisable?
Yes, that is highly advisable. And also, for those that might be diabetic having high risk, it's very advisable that they're eating the proper foods and they're maintaining a healthy weight and also exercising.
Okay.
Because that will also boost up their immune system. The thing with diabetes, when those affected with diabetes, their immune system is a bit lower than the normal population. So that's why they're also at risk of having COVID-19, and complications will arise mostly among those with diabetes. For example, the viral infection itself leads to increased blood sugar level.
Okay.
Yet alone, if you are diabetic, then complications will start arising, which leads to death later.
Okay.
So even the virus thrives better at high sugar level in the body.
And a diabetic person.
Yes.
Okay. So doctor, during this period of COVID-19, with people shying away from the hospital, and most people do not have the machines at home to check their blood sugar. What do you think can be done to help people stay on the safer side?
I believe in the first place they should not be scared in visiting the hospital. As long as you're wearing your mask, you're having your gloves, or you are protecting yourself, then you have to visit the hospital to check your blood sugar level. Because, for example, Connaught Hospital does blood sugar monitoring every Wednesday.
Okay.
So it's very important that people actually seek medical help when they need it, and they shouldn't be self-medicating themselves.
Okay.
It's very important. So also telemedicine or telepharmacy can work.
Okay.
If people have problems, they are facing problems with their conditions, at this time they can actually call and we can offer the right advice.
But how do they get these numbers? So at the end of the program, would you be so kind to give us some numbers and
Yes.
hospitals or people they can call on, people who are certified to deal with diabetes, who they can call on, and then I'll put it in the comment section
Yes.
of this program so that people with diabetes and relatives with diabetes will be able to access it.
Yeah.
Okay, so now I want us to briefly talk about the foods. Can you please give me example of specific food stuff? If I'm diabetic and I do not have a dietitian, how do I know what to eat?
It's important, just like everybody, to eat a balanced diet, having fruits, vegetables, protein, and carbs. But if you were to split the plate, a large portion should be more vegetables, and the other portion should be protein, and the smaller portion should be a carbohydrate. And when we talk about carbohydrate, it has to be the right carbohydrate, which is not a refined carbohydrate. For example, lots of diabetics have this misconception that couscous is okay for them to eat because it has less carbs. It's on the contrary. Couscous is a refined carbohydrate which should not be consumed in large quantity. So my advice always is to reduce the intake of rice every day. As we know, our staple food is that of rice, and some diabetics eat up to 3 times rice, which is not I know the resources are not there, but again, there are lots of other options in the market that is as cheap as rice. They can incorporate lots of greens into their diet, lots of vegetables, not necessarily the expensive vegetables like the potato leaf, the cassava leaf. These all have nutrients. It all has to do with the way it is prepared. You know, if it's prepared with lots of oil, lots of palm oil, then it becomes unhealthy. And if it involves lots of frying of your food instead of steaming, then it becomes also unhealthy. If you incorporate lots of fish into your diet, which makes the protein component, that will also be very helpful. So eating meat a lot also is to be avoided, especially fried meats or fried fatty meats. It's good to, if a diabetic wants to eat meat, they can eat once or twice in a week, but grilled meat, roast meat. So fish or seafood is the best meat they can consume. Chicken, they can also consume it, but it has to be steamed or roasted. Yes.
All right. So, viewers, we have heard from Dr. Manal about diabetes at different level, how we manage it, what medication we can use to manage it, and we've also heard that diabetes does not have any cure. And also at the end of the program, I would put under the comment section wherein you would find contact numbers that you can call for medication, since most of us will not be able to go to the hospital. So you can call them for advice, expert advice, if you are suffering from diabetes or you have somebody that is suffering from diabetes. Check under the comment section and there will be contact numbers there and even names of doctors that she can rely on to help you manage the disease or to help diagnose you if you notice you are having the signs that she mentioned earlier. Now, Dr. Manal, one last question before we go. Diabetes and sex. What's the correlation? Does it reduce libido?
Yes, it actually affects it causes sexual dysfunction or erectile dysfunction, especially in men. Yeah, because erection has to do with increased blood supply to the genital area. Okay. So with diabetes, especially when someone has already developed starting to develop the complications of diabetes, then there's a tendency for the erectile dysfunction to occur mostly in men.
Wow, that's huge. So do you all hear that? So this is why there are several complications associated with diabetes. We should not take it lightly. We should make sure we try to get tested. If we notice any funny symptoms like doctor has highlighted, we must get tested. Don't shy away from the hospital. Get in touch with one of the contact numbers that we're going to put underneath the column section. And thank you very much, viewers, for staying with us. Please make sure you subscribe to Multimedia Plus TV to keep you up to date with Healthy Living Series. Or you can also go to our Facebook page at Healthy Living Series, or check out our YouTube channel, like and subscribe to keep us running. Healthy Living Series at YouTube. Kindly stay with us.